I am joined first by Laura Moody. Laura, thank you so much for being here. You have several titles: retired nurse, you work with the American Heart Association, you are also with the Grand Rapids Black Nurses Association, and we're talking about Black Maternal Health Week. For anyone who may not be familiar, what is this week all about? I'll start you with that question.
Well, when you think about Black maternal health, you think about the issues that are going on and the fact that there's not enough coverage, or we're not seeking the help, or we're not getting out to the doctors early enough. It's just such a need that we need to have more awareness out there. We often say the body you save may be your own, but because there's so many other health issues that goes along with that, from your stroke to your hypertension to high cholesterol, just so much is going on. So we have to know that we have to make sure that we be an advocate for each other, that we get to the doctor early, we get our appointments in. You got to start off early. And there's all kind of programs out there, even the doulas that are out there that can actually go in to the hospital. You don't have to be alone. You can always have somebody with you. If you're afraid, sometimes it's like, well, I don't know, I'm afraid to go. I'm afraid to find out if I'm pregnant. But again, if you got other health concerns going on, you need someone to go with you so they can be an advocate to let you know when you go to the doctor, listen, do I have other health issues in my family?
Yeah.
Do I have hypertension? Has there been some strokes in the immediate family? So they can start following you early on and making sure you're getting your prenatal, making sure you're getting your checks, and understanding what's going on the whole time that you're there.
Absolutely. And, you know, like you were saying, kind of that starting ahead and asking those questions and having that support is so important for everyone. And you guys had passed along with the American Heart Association some really startling statistics that people may not be aware of, just how women of color are so much more disadvantaged in the childbirth process, just when it comes to health risks and the possibility of dying in the childbirth process. Really scary stuff. Can you talk a little bit more about what those risks are and what those statistics look like?
Again, when you think about the risks and you think about the statistics and things, is that because we don't get care or we don't go ahead of time, they haven't found out, again, if there's someone in their family that is at risk. They haven't found out, you know, what's going on. How come I'm not feeling real good? They're thinking, oh, well, just because I'm pregnant. No, it could be other issues. You know, you talk about preeclampsia, things that you don't even think about if you had that history of hypertension. Well, I don't want to take the medication because it makes me sick. So they have to know ahead of time. Get with someone, get you an advocate so they can walk alongside with you to go with you to that first appointment. So you can ask those questions to know. The statistics are so high, even with they can find out even from the Michigan Department of Health to find out in regards to what is needed and what the risks are as far as the hypertension, the stroke. And sometimes if they don't go to the doctor or they don't have even the money to get the food that they need, taking the right foods and prenatals, that's also important in everything.
And like you mentioned, you gave so much good information there. You really can start with asking questions and having that support system. If women or families are struggling, you know, to know where to find that support, what do you suggest in that situation? If maybe family or friends aren't nearby, but you know, doulas, like you mentioned.
Well, even with the doulas that are out there, that they'll go with them to the doctor. Go with them, be right there with them, because they say, well, I don't want to be alone, or they're afraid to let someone know. Our thing is what we say, even in our churches, we're to the point now where a lot of the Grand Rapids Black nurses are in the different churches. We say, get with a nurse. We will go with you to your appointments. We'll go with you to make sure that someone, whoever you're talking with, that you understand. And because a lot of times when you're first pregnant, you don't have a clue. You don't know what's going on. And you're afraid to say anything. You're afraid, first of all, to let your parents know, because you're not supposed to be having sex, of course. But find a nurse, or know that the nurses that are out there, we're there to help you. We're there to walk with you. We're there to go with you to your appointments, making sure that you understand. That is just so key at an early start, to know, to get those prenatal vitamins, to know that it starts with you. And again, we always say the body you save may be your own. So in order for that to be your own, you have to take ownership. You have to be an advocate for yourself. You have to speak up. If you're not sure, ask questions. Where do I get the right foods at? What foods should I be eating at this time? If I got my mother had hypertension, does that mean I'm gonna have hypertension? Yeah. If I start off and my blood sugars are way off whack, I don't even know what that is. Get with someone that can talk with you, tell you what's going on. There's a lot of help out there. Again, I would say the doula programs, you even got GRAHI, they have a doula program. We have doulas that's involved with the Grand Rapids Black Nurses. There's all kind of programs out there. So look at what resources are there, you know, on the website. You know, you can go GRBN website, you can go to GRAHI website, you can go to Michigan, the AHA, American Heart Association. There's all kind of resources that are out there. So it's a matter of tuning into what's out there, asking questions, because again, the body you save may be your own.
And when you're talking about preeclampsia, stroke risk, things like that, if someone's not familiar, with those conditions or what those can look like, this is serious stuff that we're talking about. Can you just shed a little bit more light on just how serious, knowing, that family history or, what those things could lead to versus if you're taking care of them, they can be managed. How serious can some of these conditions be when you're pregnant?
When you're pregnant, some of these, they can be unto death. Sometimes you have a mother that has died. She's in to the point where her blood pressure is sky high, or even during the delivery of the baby. We've had them where there's been infant death. And it's because, again, mother was not taken care of, did not do prenatals, did not get help, and she waited too late. And by the time she got there, she was in, her body was already shutting down. And so you have to, again, understand that just because you're pregnant, you're thinking that some of the changes you're going through are just because you're pregnant. It may not be.
Right.
So you have to go and you have to get help so you can understand. Again, I always say the hypertension, because they say, oh, it's just up because I'm pregnant. No, it could be other reasons.
Yeah.
And you could be on medications and things. So I don't want to take medication. It might affect my baby. Most of the doctors and things that you're going with, they will know what you can do, what you can't do. They'll know medications that you can and can't take. So early start, early prevention is just so important to start early. If you can't afford it, there's so many programs that are out there. There's so many clinics that are out there that can help each and every one as far as any kind of help that they need, from economics to medical, just transportation, whatever is needed. The help is out there, but you gotta start early.
And for anyone who might be watching that, maybe is a parent or a relative of someone who's pregnant, and, maybe they're hearing this and they're like, okay, how can I help with this process? What's your suggestion there? Especially, I know you mentioned, if someone is concerned about people knowing that they're pregnant or nervous or scared, those resources around someone, what's your advice to them?
I always say, and I usually when I run into young ladies and they say they don't want people to know, I said someone has to know. Because you keep things all hidden inside, then when you're in a crisis, it's too late. So you have to talk. You have to find a person, be it in your church, because a lot of us go to our churches and everything, be it in your church or the community, have a resource that you can go to and just say, look, I'm pregnant, what do I need to do? First of all, where do I need to go? Clinics and things, there's funding that, well, I don't have any money. I'm out on Medicaid. I don't have any insurance. What am I going to do? Start tapping into the resources. Again, I say start at your local, even your health department. Start with some of your churches, because a lot of our churches have our nurses in them now. And we are resources as far as letting you know what you need to do and how you can go about getting the help that you need.
Absolutely. Anything else that you just want the community to hear, this week, but of course this is important all year round, but anything else that I'm missing or that I haven't asked that you would just, like anyone watching at home to know?
The main thing I always say is that our bodies are so important, and sometimes we don't always understand what's going on with our bodies. Anybody, doesn't have to be a nurse or whatever. And I find myself sometimes, even when I go to the doctor, sometimes with families and everything, sometimes misinformation or not asking the right questions or not getting enough information. They don't know what to ask. So sometimes I'll ask questions and then the doctors just give more information. So, but if you're afraid, take someone with you. Have you an advocate or spokesperson that could help hear what you're hearing.
Kind of help back you up in that scenario.
Then keep a little journal so that you can write down things. So if you're not sure of something, then you come to people that may know more about it so they can help you make sure you got the information that you need.
And I know there can be scenarios where people are into, especially women, where maybe you are talking to a doctor and you don't exactly feel like you're being heard, or you don't exactly feel like your concerns are being addressed. If someone is feeling that way, what's sort of the suggestion from you there?
Usually I tell them again, find an advocate to go with you. And once you find that person to go with you, and again, I'm usually open I have a 24-hour book. They can just call me anytime. And it really, my concern is that you are getting the right help that you need. So find someone to always go with you, because sometimes you're hearing something different when you're not thinking about it. So find someone to go with you, listen to what they're saying. And if you're not sure of something, you can always get another opinion.
Sure.
It does not hurt to go to another doctor and say that, just start all over again. Sometimes it's not easy. You've been with a person a long time, but it doesn't hurt to make sure you got all the information.
Awesome. Awesome. Laura, thank you so much for talking with us about us and giving all this plethora of resources. You're so knowledgeable. We so appreciate you being here on Evening Plus.
Thank you for having me.
Awesome. Okay.